Good morning, and thank you. What was that?
I said it's Morgan. You're good to go.
Okay, thanks, Morgan. Good morning. Thank you for joining the New England Quality Improvement Network for the webinar on the Falls Collaborative. My name is Danielle Walker, and I'm going to walk you through a quick housekeeping item just to get us going, and then I'll introduce you to our moderator and host. This webinar will be recorded, and the presentation will be available within a few days. We will provide the link to the presentation in the chat, as well as call-in information if for some reason you get disconnected. Please make sure that your line is muted. We have muted all the lines internally, but just in case, we want to make sure that we're giving our speakers an opportunity to be heard. If you have questions at any point throughout the presentation, please go ahead and enter those into the chat panel to the right of your screen. We will be monitoring and responding to those questions and comments in chat, and we'll also have time at the end of the presentation to respond. Lastly, if you find that the presentation is a little cut off on your screen, you can use the plus or minus icons in the top right of the presentation window to adjust your screen accordingly. Since we're covering a lot of information during the next hour, we ask that if you have a question, please don't hesitate to type it right into the chat panel on the right, and make sure that you're addressing the whole audience. It will say send to all participants right above where you can enter the chat message. That way we can see it. And now I would love to introduce your host and moderator, Anna Guest. She is, I knew I was going to screw your last name. Anna is the Falls Prevention Project Director for the Southern Maine Agency on Aging.
Thank you so much, Danielle. I want to welcome you all and thank you for joining us this afternoon. Here in Maine, we're undergoing a revitalization effort of our State Falls Prevention Coalition, No Falls for Me. And one of our objectives is to offer falls prevention education. So we're very excited to be presenting our first webinar, and we want to thank Health-Centric Advisors for their support and collaboration in hosting with us today. So in a moment, I want to take some time to introduce our panel of speakers, but right now we want to learn a little bit more about our audience with a couple of polling questions. So Emily, if you could pull up our first polling question. And if you could just tell us who you represent. Are you here with healthcare, community-based organization, an age-friendly community, government, or other? And once you answer, don't forget to hit the submit button at the bottom right-hand corner. We'll just give people a moment to fill that in.
You don't have to call. So put your name though.
Okay, so thank you for responding. It looks like most folks are with healthcare today, so great to have you on the call with us. Let's go to our next polling question. And we're wondering if you're involved with a Falls Prevention Coalition. You could just, again, take a moment to answer, and don't forget to submit at the bottom of your screen. I will just take a moment to say if you don't have your own phone line on mute, please take a moment to just use the mute button on your phone. That will help minimize any background noise during our call today. Thank you. All right. So about half and half. Some people are involved with the Falls Prevention Coalition, and others aren't. Thank you again for that. And we have one more question for you, which is, are you aware of falls prevention activities in your area or community? So just take a moment to respond and click the submit button. While we're waiting for people to respond, I do just want to say how exciting it was to look at the registration list for this webinar and see folks planning to attend from all around the New England area. It's really exciting. We have some great energy going in New England with grant funding through the Administration for Community Living and Falls Prevention Coalitions, and it's just really neat to have a chance to bring folks together from all over. So thank you again. And we have our answers to this final poll. And it looks like most people are aware of some kinds of fall prevention activities in your community. Well, thank you for taking a moment to help us learn a little bit more about you. During today's webinar, we're going to hear from each of our panelists with a brief overview of their state's fall prevention coalition. And then we'll open it up to some more targeted questions that highlight special projects, initiatives, and best practices. We would love to hear from you, so as Danielle said, please do use the chat feature to enter questions as we go along, and we'll be sure to leave time for questions and discussions at the end of the presentation. So now, join me in welcoming our speakers. We have Donna Pidgeon, a physical therapist with the Dartmouth Center for Health and Aging, and she represents the New Hampshire Falls Risk Reduction Task Force. With the Falls Free Vermont Coalition, Angela Smith-Jang is the director of the Vermont State Unit on Aging. Helen Magliozzi is the director of Regulatory Affairs at Massachusetts Senior Care and a tri-chair of the Massachusetts Falls Prevention Coalition. And Ellen Schneider is a consultant with the National Council on Aging's National Falls Prevention Resource Center. Thank you all for joining us today and being so willing to share your expertise. And I want to just now turn it over to Donna Pidgeon to give us an overview of the New Hampshire Falls Risk Reduction Task Force. Go ahead, Donna. And if you are on mute, pound 6 should take you off mute.
Can you hear me now?
Yes.
Okay. Okay, well, thank you, Anna, for the introduction, and thank you for putting this great webinar together. This is really exciting. I'm looking forward to hearing from everybody today. So, as Anna said, I'm one of the two co-chairs for the New Hampshire Falls Risk Reduction Task Force, and Deborah Samaha is the other co-chair. Go to next slide, please. Thanks. So just a little bit about our history. So we were organized in 1999. We believe we're the oldest continuing state falls coalition in the country. And we were organized in response to an injury surveillance report through Health and Human Services that showed that hospitalizations and deaths in older adults due to falls was increasing, while at the same time hospitalizations and deaths due to other injuries in the state were decreasing. We're not legislated or funded by the state or any entity. We're not funded. And we are members of Falls Free Coalition. We have an electronic membership of about 300 professionals, and we have about 20 regular members who attend our monthly meetings in Concord at Health and Human Services. Our primary goals are to reduce the rate of death and disability of older adults due to falls, reduce falls risk in older adults, educate and train professionals, and to raise public awareness that falls are not a normal part of aging. Next, please. So key objectives. We want to try to encourage fall screening and then appropriate referral to services for all New Hampshire residents 65 and older at all points into entry points into the healthcare system. Also to establish a statewide resource network for evidence-based fall prevention programming in both healthcare and in community settings. And also to support and disseminate collection of multiple data sets, so to help evaluate efforts at a statewide level and also a local level to try to prevent falls in older adults. Next, please. So our key partners, we have several organizations that have been key partners for most of our existence, and the Dartmouth Centers for Health and Aging, the Northern New England Geriatric Education Center, Foundation for Healthy Communities, the Injury Prevention Center at the Children's Hospital at Dartmouth-Hitchcock, and that's our other co-chair, Deborah Samaha, is the coordinator for the Injury Prevention Center, Dartmouth-Hitchcock Health Center, and also the New Hampshire Injury Surveillance Program through Health and Human Services. And then we have a variety of aging services networks, and then many individuals who are from a variety of hospitals, outpatient clinics, long-term care facilities, and visiting nurse agencies, as well as we have regular members who are implementers for the evidence-based programs in the state and folks from our public health networks. So our measured outcome at a state level are, we look at deaths, hospitalizations, and emergency department visits due to falls. We measure through E911 falls that are due to falls, and through EMS run data, through Texas, the statewide EMS electronic medical record, and then also the dissemination of the two evidence-based programs that we run in New Hampshire, Tai Chi Chuan, Moving for Better Balance, and A Matter of Balance. Please. And then finally, some of our selected initiatives. So we have, in recent years, starting in 2014, collaborated with the Foundation for Healthy Communities, who has been a longtime partner with the task force, where we were awarded our first ACL grant for increasing evidence-based programming. And then with the Dartmouth Centers for Health and Aging, we were awarded a grant in 2015 to further increase the evidence-based programming and throughout the state. And then we were just awarded a 2017 grant. And again, the two evidence-based programs that we have in New Hampshire are A Matter of Balance and Tai Chi Chuan, Moving for Better Balance. And our sort of separate, the Dartmouth Centers for Health and Aging 2017 grant also includes collaboration with 3 other states, Massachusetts, Connecticut, and New Jersey, in implementing and developing a training center for the Tai Chi Chuan, Moving for Better Balance. We have collaborated with the Dartmouth Centers for Health and Aging to enhance our website. So we have now an interactive self-screen from the study for assessing falls risk, and also interactive evidence-based program maps, so somebody can go to a map and see where the closest program is for them and information how to contact individuals to register for the programs. And then we've also added, our instructors for evidence-based programs, where they can enter in when they're starting their program, so that we can get that at the centers, and as well as having the materials for our instructors available, our questionnaires, our data reports that they need to fill out for the grant. We've collaborated regularly with the Foundation for Healthy Communities and the Northern New England Geriatric Education Center to provide annual conferences for professionals, which we've done for a number of years, and this year we're going to actually be splitting into 2 conferences, one in the spring and one in the fall, to have a little bit more targeted audiences. Because it's an annual data sharing meeting for statewide and local initiatives, and it's always in March, so our data sharing meeting will be Tuesday, March 6th from 9 to noon, and that's available to attend online as well, so I'm happy to share that information with anybody who'd like to participate in the data sharing meeting. And then we are partner with different organizations to promote the annual fall screening and primary care, so certainly with a variety of healthcare entities and with our community health centers as well, who have done a great job implementing the steady screening for falls assessment in primary care. Very much.
Thank you, Donna. What's just really interesting as sort of a newly growing coalition, I'm really interested to see, it sounds like, or looks like you have a lot of collaboration with multiple partners that allows you to get some really nice depth on the data and measured outcomes that you're able to show from your coalition's work. So that's really interesting. I would love to learn more about that. Thank you so much for sharing. Angela, I'm going to turn it over to you. And again, if you're on mute, #6 should unmute you.
I think I'm unmuted. Can you hear me?
Yeah. Welcome.
Great, thank you. This is Angela Smith-Dang at our State Unit on Aging in Vermont in the Department of Disabilities, Aging, and Independent Living, and I'm happy to be here with you all for this call. So I am one of 2 co-chairs for Falls Free Vermont, our Falls Prevention Coalition. The other co-chair is Tanya Wells at our Vermont Department of Health. And so next slide. I just wanted to briefly share a little bit of the history of the coalition. It's really varied over the last 10 years based on where there was funding and momentum and opportunity. So it's kind of ebbed and flowed a little bit. The coalition really reinvigorated in 2016 when our Department of Health had an ACL grant and a full-time falls prevention coordinator at that time. So there was a lot of momentum building through that effort. And in 2017, the Department of Health lost that funding and coordinator, but VDH and Dale, we committed to continuing that momentum and co-chairing the coalition going forward. You can go to the next slide. So basically how we're currently working is, we've developed our mission and our scope of work and our structure. It's a coalition. We have both organizations and individuals together trying to reduce preventable falls, injuries, and deaths in older adults. We have focused primarily so far on trying to provide statewide resources, raising awareness, and increasing education and training. We meet quarterly in a central location, usually in Waterbury, and additional meetings and other calls and things as needed. And we've had subcommittees that work on specific projects like marketing for Falls Prevention Awareness Month, for example. We really try to have really strong communication and good collaboration and consensus whenever we can. Next slide. The membership of Falls Free Vermont is diverse, evolving, growing all the time. With the 2 state agencies, Department of Health and Disabilities, Aging, and Independent Living in the coalition and kind of co-chairing at the moment. With all 5 of our area agencies on aging, home health agencies. We have the University of Vermont Center on Aging and the Department of Physical Therapy involved. Both Dartmouth and University of Vermont Medical Center are involved, and a few of the other regional hospitals have representatives on the coalition as well. Our supportive housing collaboration staff is involved, along with the Physical Therapy Association. We have our statewide Tai Chi training organization involved, Association for the Blind and Visually Impaired, like Benefits Center, RCC, YMCA, and I'm not even naming everybody. So it's really grown quickly, and it's a real interesting combination of both folks really focused in community, working on community programming and support for older Vermonters, and those really focused in the clinical work. So that's been really interesting as we've grown. Next slide. And so far, with 2016, 2017, as long as I've been involved in the coalition, we've really focused on trying to build out more statewide awareness of falls as an issue and the falls prevention programming in the state. So we launched last year a website, fallsfreevermont.org. I think that was a big accomplishment for 2017. And the website has information about programming with Hampshire State, about the issue, about how to talk about it, links to lots of different organizations in the coalition and outside of Vermont, resources, et cetera. And we have a student project at UVM right now looking at the website with other Vermonters themselves to get their feedback and recommendations and making it the best it can be and more user-friendly. And we'll be taking that information and then doing more promotion through the marketing committee. We also were really focused in 2016-2017 on expanding access to programming across the state. There's still some geographic gaps for sure, but in most places in Vermont now, there is a falls prevention program offered in communities, whether it's Tai Chi, a matter of balance, phone builders, and that continues to grow. The area agencies on aging in Vermont have really taken a strong lead in building that program, building the programming out in communities, along with using a lot of the SASH supportive housing sites as places where programs are offered. And then the clinical folks have really taken the lead in raising awareness around, as you said, the study training school, both in clinical settings and in the community. So in 2018, as we look ahead, here we are in 2018 already, and the steering committee is helping to lead the coalition through a strategic planning process. We can really look at our direction for the future, sustainability, impact, etc. The marketing committee is really going to try to push the website out further, especially to medical providers, to be increasing referrals to programming. We'll all be continuing our work together around Falls Prevention Awareness Month, and then we really want to make progress on data collection. Our Department of Health does a fabulous job of collecting and sharing with us good data on EMS, hospitalization, DR visits, deaths, et cetera. But we don't have good coordinated data systems for the actual programs, participation, and outcomes. So that's sort of the next step that we really need to get to if we're going to be able to move things forward. So I think that's probably enough of an overview.
Wonderful. Thank you so much for sharing. It's very interesting to hear about your recent shift and kind of redefining, your model after you've had a change in funding, but also your diverse membership and looking where you're going in the future. So we will look forward to circling back to learn more about some of those topics. Thank you, Angela. Helen, I'm going to turn it over to you for Massachusetts.
Great. Can you hear me?
Sure can.
That's great. Well, I want to thank you for asking us to participate today. The Massachusetts Falls Prevention Coalition, actually you can change the slide if you want. We were established back in 2006, 2007. There's still some discussion as to what the actual year was that we were established, but we have the three organizations that came together: Massachusetts Senior Care Association, the Home Care Alliance of Massachusetts, and the Massachusetts Department of Public Health. In 2007, we held our first Falls Prevention Awareness Day at the Massachusetts State House. And this is sort of our banner event, and we hold this every year. And it really is a great event. It is more consumer-focused, but we do have plenty of legislators and healthcare providers attend. In 2012, after 2000, maybe 9 or 10, there was sort of a lull in our activity. And in 2012, we tried to revitalize the group with new leadership. So there had been turnover in leadership in in two of the three founding bodies. So we revitalized it with new tri-chairs and representation from the founding organizations. So myself and the Home Care Alliance both had changes in positions, and we stepped forward to bring this group back together. We did form a short-term subcommittee back in 2012 to really look at and revise our original mission statement. Next slide. So our mission for the Massachusetts Falls Prevention Coalition is to increase in awareness that falls are preventable, to support family and caregivers, healthcare providers, and the community about falls prevention, and to reduce the incidence and severity of falls and falls-related injuries across the lifespan in Massachusetts. And what do? We really collaborate with individuals and organizations that work on fall prevention initiatives across all settings. We share best practices, information, data, and strategies, and most of that occurs at our quarterly meetings. We advocate for policy and resources. We promote healthy lifestyle, falls prevention, education, and training, and we support research that enables the implementation of evidence-based programs. Next slide. So just some of the basics. The tri-chairs for our coalition are myself, Colleen Bayard, from the Home Care Alliance, and Rebecca Thomas, who's from the Department of Public Health Injury Prevention and Control Program. We currently have about 150 plus voluntary members on our distribution list, and that has steadily increased since 2012. We usually have about 18 to 20 people that attend our quarterly meetings, and we do provide a call-in feature for people, but it has to be by request because we really want to encourage people to attend these programs in person. So our membership, as you can see on the slide, is pretty broad. We have state agencies, we have representatives from healthcare, medicine, nursing, OT, PT, pharmacy, we have community health workers, community-based organizations, long-term care, assisted living, home care associations, researchers, advocates, consumers. We basically do not turn anybody away. If they are working on falls prevention initiatives, and they want to join our coalition, we certainly welcome them because we know they're going to bring to our coalition another, sort of set of expertise that we may not have in the coalition already. There is no funding for the coalition, as I think New Hampshire said as well. So it really is volunteers, and it has really become a great sort of networking opportunity for people. Next slide. So other highlights about our coalition. In order to join our coalition, we do ask that people fill out a contact sheet. And what we ask for in that contact sheet is, what are you working on for falls prevention activities, and what are you interested in? We do have our members present at our quarterly meetings, so if there's an initiative they're working on or something that they've completed, we ask them to do a presentation for the coalition so that, again, it's a way to educate coalition members, and in educating our coalition members go back and can distribute the information to their members. One of our strongest assets is that we regularly share via email falls-related opportunities, so funding opportunities, upcoming education and training, and again, we do that so that our members can then disseminate it further to their membership or to their colleagues. We do participate in the National Council on Aging's Fall Free Initiative and the National State Coalition on Fall Prevention Work Group. Next slide. So in our current coalition, we have two work groups. We have our Speakers Bureau work group, and our Speakers Bureau actually developed a PowerPoint that can be used for falls prevention education. It really has a community focus, and it is on YouTube, so it is accessible to anyone. We also do have one of our coalition members is a professor at college, and she has been working on doing voiceovers in different languages so that it would be available to others to use, not just in English. And in addition, our Speakers Bureau work group, we also have people who who have agreed to actually do falls prevention workshops. So or education. So if we get a request from a community provider, let's say a council on aging, or we've even had some home care agencies that want some information for their certified nurses aides, we will reach out to our Speakers Bureau work group and ask if anybody is available to do the education and training. And I think to date we have not had one request that has gone unfilled from our Speakers Bureau. We also have a social media work group, and this was a little scary at first for some of us. But as we bring more and more coalition members on, and they are younger, they are looking for how to get the information out via social media. So we do have a Facebook page that is updated regularly with information that's dispersed through the coalition. We have a Twitter account, so you will see if for our Falls Prevention Awareness Day, we will be tweeting about the event. And we also have a website which is it's linked to the Mass Senior Care website, but the social media work group actually worked to update that website information. So it's, again, linked to Mass Senior Care, and right now we're pretty comfortable with it staying there until we have somebody who's really good at website design and wants to take that on. I would be remiss in not mentioning a subcommittee that comes together every year, and that is the group that really works on our Falls Prevention Awareness Day. It is a short-term group. It usually starts working in about April or May and concludes with our Falls Prevention Awareness Day in September. Next slide. So here's information. If you want more information on our coalition, our website page, as well as myself and Carlos Acercia, who's really the liaison between the coalition and the tri-chairs and pulls everything together for us. If there's our email addresses, you can feel free to email us if you have any questions.
Thank you, Helen. A nice overview, and what always strikes me about your coalition that I find really intriguing is it seems like it's very inclusive and very focused on networking, and so I look forward to hearing more about that with some of our panel questions. Okay, so I want to now turn it over to Ellen Schneider with NCOA.
Great, thank you. Can you hear me?
I sure can. Thanks, Ellen.
Wonderful. Terrific. Well, thanks. It is a pleasure to be joining you today on behalf of the National Council on Aging's National Falls Prevention Resource Center. Next. And I just want to spend a minute telling you about the Resource Center in case you're not familiar with us. We are funded by the U.S. Administration for Community Living, or ACL, as you often hear. And one of our major objectives is to increase public awareness, educate consumers, professionals, others about falls risks, how to prevent falls. We have a ton of resources on our website with tools, best practices. I'm going to go over a few of those resources later, but do invite you to go to the website, which is listed at the bottom. It's actually easier just to Google NCOA Falls Prevention Resources or Resource Center, and poke around on the website. You'll find lots of stuff. The vast majority, I think all of it is free that's on there. Another major effort that we have is supporting the dissemination of evidence-based falls prevention programs. So we work very closely with the ACL falls prevention grantees to help them be as successful as possible in the implementation of their grants, as well as supporting the state falls prevention coalitions. We have quarterly calls, and I'll get to that a little bit more in just a sec. If we go to the next slide on the National Falls Free Initiative. I'm waiting for that to pop up.
Oh, are you not seeing it?
I am now. Yep, got it. Okay. So several of the folks who have already presented talked about the National Falls Free Initiative and being members. This actually preceded the National Falls Prevention Resource Center. The Falls Free Initiative has been around since around 2005. We created a national action plan, a National Falls Prevention Action Plan in 2005. updated that in 2015. But the Falls Free Initiative is really just a big national coalition of people, organizations that are passionate and working on falls prevention. We started out actually just having national organizations as members, and actually the state fall prevention coalitions that were in existence in the 2005-2006 timeframe, there were about 4 of them, and of course, John, as you had mentioned, the New Hampshire Falls Risk Reduction Task Force was the first, but there were about 4 at the time, and they said, hey, we are working on this, and would like to be members of the Falls Free Initiative too, and we said, absolutely, please come on board. So we, again, started out with around 4 state fall prevention coalitions back in the 2005-2006 time frame, and we're now up to about 43, which is just so exciting. And again, working collaboratively to bring awareness and education and evidence-based interventions to communities across the United States. Next slide. So I'm always hesitant to put up a map of state fall prevention coalitions because there is movement, but this was accurate around the 2016-17 time frame. Again, around 43 state fall prevention coalitions. Each state is different, of course. Each state coalition is different, and each is approaching falls prevention a little differently. Next. So I'm not going to go into this slide right now. In a couple minutes, I'll be talking about some state fall prevention coalitions and some of the innovative things that they are doing. Next. I had mentioned the National Falls Prevention Action Plan, and if you haven't had a chance to take a look at that, please do. There are a lot of great ideas in there about, not just at the national level, but what states, what organizations can be doing to address falls prevention. The plan was written with the input of falls prevention experts from around the country. It's not just an NCUA document. It was reviewed by organizations such as the CDC, ACL, many other organizations. And right now, some of our primary efforts are around, one thing we're doing is expanding evidence-based programs that are on the pre-approved list that ACL has. So in other words, the list that a lot of organizations such as senior centers go by for their Title IIID funding, and also the list that is available at falls prevention programs when grantees are applying for ACL grants. There are other programs out there that we know are effective and want to be on the list, so we have created a process, a review process, a comprehensive review process for organizations to apply for that, and we have wonderful experts on that review panel, and we have added 3 new programs to that pre-approved list that have been proven to reduce falls or reduce falls risks, and that's an ongoing effort. We're in the middle of the second stage of that review, the second cycle, I should say, of that review process, looking at a whole new round of applicants. We're also working with pharmacists and their role in falls prevention, and have a strong partnership with the American Society of Consultant Pharmacists. Lots of new resources being developed around home and community safety. And of course, one thing that NCOA is working on constantly is public policy and advocacy. Next. So I mentioned resources, and want to make sure that this is just a few, just highlighting a few of the resources on the website. One of them is, actually that first one listed, a toolkit on how to create a falls prevention coalition, and all of the folks that just talked obviously are well down the road, actually contributed to that document. But if there's anybody that's thinking about starting a falls prevention coalition either in your state or perhaps locally, that's a great resource to take a look at. On the slide, you'll see the osteoporosis and falls fact sheet. We have a toolkit now with the American Society of Consultant Pharmacists that is available on their website. The terrific resource, the End for Pharmacists. Lots going on around home assessment, modification, funding resources around home assessment and modification on our website. And we just created a caregiver and fall prevention toolkit. So please, again, visit the website. Just Google NCOA Fall Prevention Resources and take a look around at some of the other ones that are there. Next. So just wanted to end my little spiel here. This webinar is a wonderful example of stakeholders working together to prevent falls. The New England's getting together here and the webinar. And NCOA just absolutely applauds what you're doing collaboratively and also individually. Of course, the issue of older adult falls is just way too big for any one of us to tackle alone. So we thank you for all that you're doing. And my last slide is questions, so I think we're going to save those till later. But you have my contact information, and I'm happy to answer any questions, whether on the webinar or later. Just feel free to shoot me an email.
Fantastic. Thank you so much, Ellen. I can say as ACL grantees and also actively involved in getting a falls prevention coalition a little more up and running, that the resources that NCOA has to offer are just invaluable. And so we really appreciate your time and pointing some of those out to the group and being available. So thank you. All right. So I want to just thank each of you for your overviews. It's just wonderful to hear what you each have going on in your state. And to the audience, keep the questions coming. If you've already thought of some, don't hesitate to type them into the chat box, and we'll come back to them. So I want to start off with some of our questions, and I'm going to circle back to you, Donna, in New Hampshire. I'm curious, how have your relationships and partnerships allowed you to initiate evidence-based programming and education initiatives without that funding? You talked about how your coalition isn't funded or legislated, and so I'm curious how the relationships in your state have made that possible.
Excuse me. Thanks, Anna. Yeah, sure. So, I mentioned in recent years, in 2014 and later, we've had some, federal ACL funding to help with those initiatives, but certainly, since we've been around since 1999, we had many years without major funding. So really, we've just, with building the relationships, we've had so many organizations over all these years who've donated really in-kind time to allow, people working in their organizations to come to the meetings, to work on projects. And we've had so many dedicated professionals who just, have a passion for reducing falls in older adults and working with older adults that have also donated a lot of their time. And a lot of individuals, we did procure small grants over the time from statewide organizations or, other entities which have helped us to do little projects as well. I think we've really, kind of like, as Massachusetts said, and I'm sure Vermont is like this too, really all comers. We have an open meeting, open monthly meeting. We're always getting new people, and we're excited to see new people. We just had partners from so many different backgrounds and regions bringing different perspectives and talents and networks to help expand the initiatives. And certainly our partnerships with entities like the Geriatric Education Center and the Foundation for Healthy Communities, so that they've donated a lot of resources enabling us to bring great speakers to our annual conferences and keep the cost really low for participants so that we can reach up to 150 or so people, 130 to 150 people a year for our conferences. So we've really, have a lot of organizations and individuals to thank for the tremendous effort that they've put forth.
That's great, and very interesting to hear about a little bit more about your conference that you've put on and strategies that you've used to keep the cost low. That's really useful to hear. Thank you. So I want to ask Angela in Vermont, I know you're currently in the midst of some strategic planning efforts, and I'm wondering if you can tell us more about the direction that you're taking and how your members have been involved.
Sure. Well, we were lucky enough to kind of be in a place for wanting to do some strategic planning at the same time that UVM Medical Center was able to provide us with a little funding support to have a facilitator, a consultant come in and do that with us. So we, our steering committee, which is a group of about 5 or 6 organizations, has really been leading that effort. So we brought the idea to the whole coalition and gathered input in terms of what people think would be the best in terms of using this opportunity to have the most impact for the coalition. And so we're having a retreat day coming up really soon in the middle of March. We're using a whole day to kind of look at sort of where we've been, where we're at, and where we're hoping to go. I think from the steering committee's perspective, we really are hoping to think about sustainability and longevity. It's really heartening to hear from our neighbors like New Hampshire and Massachusetts that have been doing this for a long time and have been able to sustain it in different ways. And I think Vermont's, trying to figure that out too. So we'd like the strategic planning to come out with some clear direction and action of what, everyone's kind of doing their own work in their own part of the piece of the puzzle, whether it's in their hospital setting or in their AAA region or whatever it might be. And so it's a question of how best to coordinate that and what resources can state agencies, can the clinical community, can community-based organizations best bring to that work, and how do we do that best together? I think there's different models that, different states are trying, and so we're just asking a lot of those questions and kind of looking really deeply at where we're at and how to move the needle in the best way, and also really taking into consideration, I think another reason we're lucky to have the time to do a retreat and sit back and reflect is that there's a lot changing in the world of healthcare. In Vermont, it's the hot topic of conversation all the time, and what's great is that a lot of healthcare organizations and hospital systems are really looking at health in a new way, and are looking out to the community to see about collaboration.
Angela, are you still there, or are you left out a little bit? Okay. The last that you said kind of faded out.
Sorry, I was just saying that I think with health reform happening, it provides a good opportunity to think about how to leverage that in terms of working with the coalition.
Great. Well, thank you for your insights here, and it's interesting what I've heard you say and Ellen was saying as well is that there are so many people across settings involved with falls prevention, and that we all have our little part to play, and bringing everyone together and building on our strengths collectively, I think, is so important to this issue. So I want to thank you for highlighting that as well. All right, I want to move on to Helen and ask you, your coalition, as you mentioned, has a robust falls prevention awareness day every year, and I'm curious, how do you get the message out about falls prevention? Who are the key players, and what are some of the activities that you focus on for FPAD?
So, yes, Falls Prevention Awareness Day is our signature event. Again, as I said, we bring together a subcommittee to work on how to Falls Prevention Awareness Day forward. Over the last several years, we have had a number of different speakers. We do have a speaking program that goes along with it, and actually Ellen Schneider was one of our speakers a few years ago. And then what we have done in the past is that we have resource tables set up at the State House, and those tables are manned by our coalition members, and they sign up. In the past, they've signed up to man a specific table, and we look at the risk factors for falls. So we may have 2 or 3 tables that focus on medications. We may have 2 or 3 tables that focus on vision, balance, all the risk factors that have been identified through the NCOA on their fact sheet. So again, it's coalition members. They're not coming to sell their wares, but they're coming to provide information to the people who attend on those specific topics. This year we changed it up a little bit. We sort of decreased our speaking part of the presentation and of the day, and we did a scavenger hunt. We were a little concerned at first that it wasn't going to go well. But I think we actually ended up increasing our number of tables. So I want to say we had about 20 tables, and we gave all of the participants a list of things that they needed to find at a particular table. That way we were sure that they were actually going to each table, getting the resources that were available to them, and then their name went into a drawing if they actually went to every single table and had it checked off. And so we often raffle off prizes at the end, which I will tell you we have a good group of consumers that come every year, and that's a favorite part of the program. We usually also have a demonstration, whether it be matter of balance, Tai Chi. We bring in a group from the community that does this, or from a senior center, a group of seniors that go to a Tai Chi program every week or go to a matter of balance program, and we have them come to the Falls Prevention Awareness Day and demonstrate for the people in the audience. We have had, great help from our coalition members as far as getting the information out. So the Mass Council on Aging are a great partner. They send out the information on our Falls Prevention Awareness Day to all their councils on aging and tell people to get people there. A lot of our members have newsletters and distribution lists within their organizations. They use that. We invite legislators through, we send them emails, with the invitation. So we haven't had a difficult time, just using the coalition members to get the information out. There has been talk about should we be reaching out to a larger group, making a video that could go into physicians' offices, the week before, sort of discussing falls and the Falls Prevention Awareness Day. But we have yet to move on to those sort of bigger sort of media pushes to make people aware of our Falls Prevention Awareness Day.
Interesting. I'm curious, what's a typical turnout for you guys on an FPAD event?
We usually get about 150 plus.
Great.
So and every year it's gotten larger and larger. So, again, we tried to sort of revamp it a little bit this year and have less of a speaking presentation and more of sort of a resource fair type of situation. And the feedback that we got from people who attended is that they really enjoyed it. They really liked the format this year because they had more time to visit the resource tables and to talk to people.
Great. It sounds really interactive and fun, and that you pull people in from all the different areas. I like that. Thank you for sharing. So, Ellen, I want to ask you, you had mentioned in one of your slides some states that have, outside of New England, that have some really innovative initiatives going on. So, could you tell us a little bit more about some of those things?
Sure. There's just a few things that I wanted to highlight. And one of them is in Arizona. They are hosting what they're calling a Light Up the Night event during Falls Prevention Awareness Week. I think they're holding a whole week there. But it's an event to remember those that have died as a result of an unintentional fall injury. So it was, really innovative, and they had good attendance and had sponsors, and so it, again, helped to bring a lot of attention to the issue of older adult falls. They also have in Arizona, the Mesa Fire and Medical Department has its home safety education program and an older adult program that focuses on fall prevention. Includes visits to residents' homes to do fall assessments, talks about fall and fire safety in the home. They look at grab bars, shower seats, bath mats, smoke alarms, a lot of ways kind of like remembering when, if some of you are familiar with that. But in 2017, and they're involved with their coalition, in 2017 that program made 300 visits and spoke face-to-face with about 470 residents of that city. And they are partnering, the Mesa Fire and Medical Department is partnering with Rebuilding Together, the Arizona Burn Foundation, and the Red Cross. And Rebuilding Together supplies the fire department with a grab bar, shower seats, and bath mats. And we're seeing a lot of partnering across the country with fire departments and EMS in different capacities. That's just one around home safety. Some are working with their fire departments around referrals and have active EMS and fire departments on their fall prevention coalitions. So, again, not just every state, but every community is a little bit different, but EMS, first responders are definitely seeing that a lot of their calls are for falls, and they are in many communities quite enthusiastic about getting involved and being proactive and not just reactive. In Iowa, the state had a Tai Chi class. They held a Tai Chi class at the state capitol, which I know Massachusetts has done and maybe some other states have done in the past. But what's a little different twist on theirs is that they live streamed it on Facebook and had, over 250 people who viewed the video when they live streamed that. So that was kind of cool. And then Hawaii, and I'm not going to get into too many details because I want to talk about this with the healthcare part of it, but they have been working extremely closely with pharmacies and for their fall prevention events, really getting involved. 66 pharmacies across the islands participating in Fall Prevention Awareness Day, doing balance reviews and screenings and, of course, medications reviews. So that has been, again, we're seeing a lot of activity with working with pharmacists. So it's great to see them coming on board and being active partners as well.
Neat. Thank you for sharing what's going on around the country. It's easy to sort of get caught up in what's going on in our own local area, and it really is inspiring to hear what other folks come up with. So thank you.
Right, and if I could just mention again, that's just a small sampling. There's so many states that are doing creative things, but those are just a few that I wanted to highlight.
Thanks, Ellen. Okay, so let's see. I have a question for Donna in New Hampshire. I'm hoping you can sort of start us off with this, but I welcome other folks to join in and kind of getting more into your partnerships with healthcare. So, Donna, for you, I'm curious, you have a healthcare organization as a leader of your coalition. How has that impacted your initiatives, goals, and successes?
Sure. So I think as everyone knows, it can be challenging for community-based organizations and healthcare organizations to communicate, and we need to have that communication and partnership to have effective falls, reduction initiatives taking place in communities. And so I think it's been helpful to have a lot of, and not just, with leadership, but we have a lot of members who are from healthcare organizations. So to help bring the healthcare organization perspective and known challenges that come with being within the healthcare organizations as we develop initiatives with our state-based partners and our community-based partners. And, certainly there's been a lot of collaboration in terms of, like in Dartmouth with our ACO, one of the metrics was for screening for falls. So we were able to get the 3 fall screens questions, that we are also looking at in terms of community-based organizations and to the electronic medical record. And that sort of has been a springboard for a lot of things, including, as we were applying for the ACL grant, how are we going to leverage some of these existing relationships in terms of ACO, and then with connections around the state. I think it's been helpful that it's helpful to have professionals speaking with each other. They kind of understand the same language. So if we can help make that connection with healthcare organizations, with professionals talking and then communicating, because we have a lot of folks who are overlapped in both worlds. So, I'm in both worlds. I'm in community-based and I'm in healthcare-based, and so are a lot of our partners. So it's good to be able to bring both of those worlds to the same place, working on the same project to help in making those connections. And I think certainly just as our focus that we've had in our conference with our annual conferences that we have, we have a combination of healthcare experience and background and connections with professionals around the country, as well as our community-based professionals around the country. And so we've been able to bring a variety of educational opportunities as well.
Thank you. I think being able to speak the same language and having, a foot in both sides, both healthcare and community-based, is really important. And I think more and more so with the changes in healthcare that we are seeing, that's going to only become more relevant. How about, Helen or Angela, how have your coalitions engaged or partnered with healthcare providers? And I'm just curious for any success stories that you might have to share there.
I would say that our partnering is really is them becoming members of the coalition. So we have a coalition. We have some insurers, representation from insurers on our coalition. We also have representatives from, let's say, our Met Hospital Association, and other programs that are taking place within hospital systems, like Tufts, Brigham and Women's. They all have representatives from sort of their injury and falls prevention work that attend our coalition meetings. They have been really, I would say, helpful in presenting information about their projects, their initiatives to the Falls Coalition. So it's been a great networking opportunity, and it's a great opportunity for us to learn what each other is doing. So that's really how we've engaged them, more as members of the coalition, and sort of providing information and networking for others.
Great, thank you.
Angela, this is Donna. If I could just, one other thing I wanted to mention is that we, certainly, we think about referral into evidence-based programs, and there's a lot of initiatives for primary care providers and connecting, that entity with community-based programs, which, we've done some work with. I know Massachusetts has done a lot of work with as well. And we have a lot of physical therapists on our, as members of our task force. And the other thing that I think is good for people to think about in terms of recruiting people into their evidence-based programs is partnering with physical therapy and occupational therapy departments, because, of course, professionals that see people for rehab with falls-related injuries or high risk for falls, and then after their therapy is over, it's sort of a natural that they need to be connected with programs in the community. So we can, develop partnerships, and we have some retired PTs actually running our community-based programs, but then we have some communities where we've just made that connection of the PTs who see these patients and the people who deliver Matter of Balance and the people who deliver Tai Chi Chuan, Moving for Better Balance, and, forming those relationships in the communities to help with getting people into those programs that are important for them to follow through with after rehab.
Right, this is Angela. I would say that it's actually PTs who've been really the starting link in a lot of ways for us in terms of building stronger relationships with healthcare organizations, because they've been really they're passionate members of our coalition in terms of really understanding the issues for individuals and working with people directly. So they bring a really important perspective to the coalition, and because many of them are working in healthcare systems, they end up being a natural link between community and healthcare that, at least from my perspective, I found really helpful as we've tried to better understand how to tell the story of this issue to healthcare systems to engage them at the broader level. So I think our PT members in the coalition are really, really critical. And in terms of working with healthcare too, I think having our Department of Health really integrally involved in the coalition is important. They have a lot of infrastructure, both in terms of surveillance of data as well as communication to the public. So trying to leverage both of those connections to build out the awareness work, as well as the understanding the issue and connecting that to healthcare organizations.
Those are great insights. I think, I like, Donna, what you were saying about connecting with PT and OT departments as sort of a natural shift from more clinical rehab to a community-based option. I think that can be really valuable. And Angela, I think your insights as well around home health make a lot of sense too. So thank you. We've gotten quite a few questions from our audience, so I think at this point we'll dive into some of those. So let's see. Our first was, are each of the states working toward alarm-free and restraint-free falls prevention initiatives? Anyone want to take that or chime in there?
This is Helen. Massachusetts is not, and partly because we have a wide range of organizations that are participating in the Falls Coalition. So we have not, looked specifically, and I would say that this is, I'm sure, related to long-term care as well as hospitals. So we have not begun to look at that as a coalition. And I think mainly, as I said, because we have a real broad base of representation on our coalition, and it would be, I would say we would be sort of pinpointing it to only, certain or smaller group of people on the coalition. We're more broad-based.
Okay. So your coalition isn't looking into just, into specifically inpatient or community-based falls needs?
Right. We have a much broader scope.
Okay. Anyone else have any insights here?
This is Donna in New Hampshire. I know one of our partners was working at New London Hospital, was embarking on a large alarm-free, restraint-free initiative and having some success with it. As a task force, as a state entity, I'm not aware of any statewide initiatives, although there may be some from our hospital-based associations, but not specifically from the task force. But the other thing that we do is, in addition to our data meeting, we have 2 to 3 additional educational meetings that we attach to we have a 2-hour, our monthly meeting is 2 hours, and 2 to 3 times a year we have a 1-hour meeting. And so when we hear, or 1-hour webinar and in-person educational sessions, so when we do hear of our partners or folks in our state with those sort of initiatives going, and Judy Cody, one of our members, did present on this, that we'll invite people to present to our 1-hour, topic for these more partner-specific initiatives that we just want to make people aware of in the state.
So along the same lines, I have someone else from Nursing Services Veterans Home asking about kind of a similar alarm-free policy, and she's asking if anyone might have resources for family or resident education around the benefits of alarm-free facilities in long-term care. Does anyone have resources that might be helpful? Okay. That's definitely an interesting topic.
So Jennifer, this is Danielle from the QIO. I'll take this back to my regional team as well. I know that here in Maine, we have several facilities that have gone in the direction of becoming restraint and alarm-free. And there were several studies done, and I believe I still have those archived, so I can send you that information, or I can send it to Anna, and she can send it to the wider audience for review. It's a difficult question to tackle because I think that there's a lot of strong evidence on both sides of that, and there's been a lot of discussion around alarm fatigue in nursing settings, and whether or not the alarm is a proactive initiative versus a reactive initiative. And when the alarm goes off, it's more an awareness that the resident or the patient has already fallen versus a preemptive warning sign. So I'll dig up those resources for the group, and I'll send it and share it to Anna and get that over to you, Jen.
Thank you, Danielle. That's wonderful. Another question we had is, what are the 3 new programs that Ellen had mentioned that were added to the, I think it's Tier 1 evidence-based program?
Yes, so those programs were Capable, which is Community Aging in Place, Advancing Better Living for Elders, and that is around home safety. And again, these are all on our website if you want to learn more. Another one that was approved is Fit and Strong, which had already been on the list of physical activity, health promotion, disease prevention programs is approved for that, and it also has good evidence around reducing falls risks. So we approved that one, and Enhanced Fitness, same with that program. It was already on the list as a health promotion, disease prevention approved program, and now it's also on the pre-approved falls prevention evidence-based list. And those are both more around physical activity, enhanced fitness, low-cost group intervention for physical activity, and Fit and Strong is more around osteoarthritis, but also has some good evidence around reducing falls risk.
Great, thank you.
Sure.
How successful and what were best strategies to get PCPs into the referral process? And what was the, Yes. And what was the percentage of success rate of patients following through on referrals? Does anyone have much experience with referrals directly from PCP offices?
So this is Donna in New Hampshire. We certainly have done some work with, trying to make some inroads from referrals from the PCP offices. We're sort of in the initial steps on how we're doing this large scale. We've worked on getting a fall screening based on the study into the annual wellness visit with a lot of practices, and then if somebody does test at a falls risk, what our goal is that then they'll refer that person to our center's number for additional fall screening. So we have our Aging Resource Center, our Dartmouth Centers for Health and Aging. We have a twice monthly regular drop-in fall screening where we do the study-based fall screen, and so we've been working with getting that information out to primary care provider offices so that they can just, once they identify somebody at risk, that they can just refer to the centers to this fall screening for the centers to work with the person. I think that's the most challenging thing for primary care providers is that they can do the screen, right? So you can get the screen into the electronic medical record. I think that's necessary so that it's an automated process. But then they need to know, what do we do with this screen? Where can we send folks? The other thing, we do have in our state a few falls clinics where it's a interprofessional falls clinic where somebody can look at somebody with more comprehensive needs. And again, I think just connecting that provider with a referral place, whether it's a regular screening or a falls clinic, so they know what to do with that screen with the patient. Oh, and I will say one other thing where we made some inroads is with our community health centers. So that they have some state funding, and so we were able to leverage that from a state level for them to get the some fall screening questions into their annual visits as well, and then we asked them to report back to us on their data and what their percentage of success is with screens. But then I do not have information as far as percentage of folks following up with the evidence-based programs in terms of directly from the providers, but we do have some information in terms of our fall screening connections.
Thank you. So what strategies could, what strategies could you provide to prevent an alert and oriented patient from falling despite repeated education? Good question. Anyone want to take a stab at that one? If not, maybe we'll get some resources out on that topic for the group.
Yeah, I think that's, Danielle, again, that's always a struggle. I think especially working with, inpatient, and when you have someone that's alert and oriented, typically they want to be mobile, they want to be independent, so you're always going to be battling that inner, that patient need to be independent and reduce the fall risk as much as possible. And I know that some hospitals have looked at implementing environmental scans, and obviously hourly rounding is a strategy that has been used in just acute awareness of folks that are higher fall risk, and even those that aren't higher fall risk. I think it comes down to education for the staff, making sure that they are, all on the same page in terms of whatever your facility has for interventions or protocols and policies around the reduction of falls and how to intervene, how to have that conversation at all levels of the facility.
Great. Okay.
I'm reviewing a question quickly before I read it out loud. Okay, so some slides indicated support of non-evidence-based programs or strategies where AAA can't use ACL funding to support these. How do you provide support to these programs? So how are you supporting non-evidence-based programs within your coalition, potentially?
So this is Angela in Vermont. I can start with that one because I think I mentioned Bone Builders as one of the programs that's very popular in Vermont in different areas. And so there's no the coalition nor the state is providing funding support for that program, but it's because it's already there are a lot of volunteer teachers who are teaching it in community, and it's really supported through the RSVP program, Retired Senior Volunteer Program. So we do in our falls prevention, on our falls prevention website, we do include Bone Builders in the list of programs that are offered in the community. We kind of look at it as a way to engage people in the idea of exercise and strength training, and if that's the first thing that they're wanting to try, or they have a friend that goes to that program that wants to bring them along, then that's a good place to start, and then eventually, hopefully they'll try another program after that. So it might be a doorway into another program, but regardless of whether it meets the highest tier criteria for funding or not, it's still being offered in the community. And I think it's actually, Bone Builders is actually was submitted to NCOA for review this year, so I'm not quite sure what the status of that is. But I would say that that is a place where we can do awareness building, and then kind of use one program as a way to engage people in the host of evidence-based programs that are available. Especially as we're continuing to still try to build out programming across the state. So in some cases, there isn't an evidence-based program that's being offered right now, but we're hoping to build that out in the future. So we want people to have access to something. I think it can be a starting place. I don't know if others have something to add there.
I think what you say really resonates with us here in Maine. We've kind of had a big focus on evidence-based programs because of our ACL grant funding, but beyond that, we've got communities that want to engage in falls prevention activities, and sometimes getting an evidence-based program out to a really rural area just isn't realistic. And so I think we have to play a role in promoting other falls prevention activities that work at that, at the community and the person level. So thanks, Angela. So I'm going to take one more question, and then we just have a few wrap-up items. So let's see. How about I love the idea of being able to find local programs and contact info for the various evidence-based programs offered. How successful has the interactive website been with senior users? How widely accepted and capable of navigating?
Does that mean, I don't know if that means in reference to the maps that I had spoke about. I know as far as our website, I don't know, I can find out actually how many, what is that called, how many hits you get or how many people have visited the website. I don't know that number, but I know in general, of course, we know that a lot of older adults are, do access websites, do use electronic devices for information, and so I think it can be very helpful. And not only do we market it to the community and older adults, but also to healthcare professionals and other community-based organizations, so that it can have a wide audience. And we have this very simple map. I think there's Google Maps, so you just can hover over hover over your town, and it pops open to see, where the program is and what the contact information is.
Great, thank you. So we're coming towards the end of our webinar time, and I just want to thank all of our speakers for being part of our webinar today. Thank you for submitting such wonderful questions. I know there were a couple that we didn't get to, so I think Danielle mentioned that she can get some resources out for some of those that we weren't able to get to. In the just couple of minutes remaining, do any of our panelists have an upcoming event that you'd like to share with the group?
This is Donna. Just our next statewide event is that annual data meeting. That's March 6th from 9 to 12 at the Foundation for Healthy Communities in Concord.
Thank you.
And this is how our next Falls Prevention Coalition meeting is scheduled for March 9th.
Great. Okay. Well, here in Maine, if you're interested in learning more about, go to the next slide. If you're interested in learning more about our Falls Prevention Coalition, please feel free to contact me and a guest. We are actively looking for steering group members as we continue to work on our own initiatives here in Maine. So please do reach out. And I just, in wrapping up, I just want to extend our immense gratitude to Donna, Angela, Helen, and Ellen, and the team at HealthCentric for sharing your time and expertise with us. And to those of you who listened in today, thank you for sharing in our webinar, and we hope that you'll join us again soon. Thank you. And I think Danielle has a couple things to wrap up as well.
Yep, so thank you so much. I think this has been really great to share all of these different perspectives from New England states. And I just love working in New England because they seem to be so dedicated and passionate about the work we do. So it's really exciting to be a part of the community at large. When you log out of this webinar, you will receive a follow-up email with a link to a very brief, I'm going to highlight that, in air quotes, survey about today's webinar. And we ask that you just take 2 or 3 minutes to fill that out because it really helps gauge what you folks need from us as the QIN-QIO for New England. We'd love to have your feedback on how to meet your needs in the community, what education we can bring, and what speakers what you really are looking to have. You'll also be getting in the next few business days an email to the email address that you registered for this webinar with. And that will contain links to today's presentation and to a recording of this webinar. I've also included as a link in the chat, which is healthcarefornewengland.org /event/any falls panel. And that will take you directly to this webinar where on the right-hand side of the page you will see links for PDF downloads of the presentation and the audio recording. It usually takes a couple days to upload, but that will be there shortly. And lastly, we would, HealthCentric Advisors would like to thank Anna and all the speakers today for bringing your expertise and your community initiatives and experts to this audience. We're really excited to have you as a part of our community. So thank you so much, everyone. Have a great day.
Thank you.
Thank you.